question. So again, welcome. I'm just going to do a little quick recap just to make sure this is covered in the recording as well. So this is it is the first of a four-part series for October in recognition of Breast Cancer Awareness Month. And the talk today we'll be covering is the breast survivorship and surveillance. So if I could have the next slide, please. Perfect. So I am so excited to welcome our speaker for today, Dr. Muna Al-Khaifi. So Dr. Al-Khaifi is currently working as a GP oncologist at Sunnybrook Health Sciences Center. She is the lead of the follow-up and survivorship program at the Louise Temetry Breast Cancer Center at the Odette Cancer Center. She is also an assistant professor at the Department of Family and Community Medicine at the University of Toronto and an affiliated scientist at Sunnybrook Research Institute. Her research interests are in breast cancer survivorship, quality of life related research, and sexual and women's health as well. And so I'm also very excited. We do have a patient presenter on deck as well. So Jennifer Schultz is Jennifer is a breast cancer survivor. She is also a board ambassador for After Breast Cancer and is a patient partner with Unity Health St. Michael's Hospital. So Jennifer is also a standardized patient at the University of Toronto and a patient teacher in the Humanism in Medicine program at U of T as well. So I'm so excited to have both of you on deck today for our session. And Muna, I will pass it over to you.
Thank you. So welcome everyone to our breast cancer series. I'm so excited to launch our series of webinars about breast cancer survivorship care with our first kickoff start topic about surveillance and survivorship care. I would just wanted to give a special thanks for Wellspring for this collaboration, and I'm so excited to be here. So as you know, I'm a GP oncologist and a women's health specialist. I'm also the lead of breast cancer survivorship program at Odette Cancer Center, Sunnybrook Hospital. I'm also a member of the Patient Information and Survivorship Committee at Cancer Care Ontario. I don't have any direct financial relationships. This particular session has not received any financial support. I don't have any other conflict of interest apart from me being very passionate about survivorship care and care after cancer, because I personally think that there is a gap in this area, and we as like healthcare professional, we need to do more to help breast cancer survivors. And I hope this talk will make you feel more empowered and to advocate for yourself. A bit of housekeeping before we dive into the topic. I'll talk a bit about surveillance and survivorship care for 20 minutes. And then Jennifer, our breast cancer survivor, as well as a well-known patient advocate, will talk about her experience for 5 minutes, and then we'll open it for the floor for their questions and if they have any concerns to be addressed. I would like to encourage everyone just to feel free to put their questions, suggestions, and thoughts. I know there are almost more than 140 people attending this seminar. I just wanted to let you know, I'm so grateful to be here, and thank you for joining us today. And I would like to know, where are you guys joining us from? And if you have any questions, thoughts, just put it on the chat box. I just wanted to remind everyone that this is a safe space and everyone is welcomed and respected. Let's start first with our objectives for today's talk. First, understand the challenges during the survivorship phase, then discuss follow-up and medical care and surveillance for breast cancer recurrence, and finally, just review some lifestyle modifications that can improve outcomes from breast cancer. Let's start first with a definition. So who are breast cancer survivors? I know some patients may disagree with the word survivors, but let's agree for this particular presentation that we define breast cancer survivors are as patients who have completed primary cancer treatment and have no more evidence of active disease. So let's elaborate this a little bit more. So for the most part, patients would usually start with initial diagnosis and work up for a few weeks, and then they move to the second phase, which is the active treatment. This includes surgery, radiation therapy, sometimes also chemotherapy, depending on the type of cancer that you have. Also hormonal therapy if you are hormonal positive breast cancer, as well as other targeted treatment depending on your type of cancer. This phase may take, I would say, 6 to 12 months, sometimes even 18 months. But after that, you turn to the survivorship phase, which is basically we know that you're cured, there's no evidence of disease, and now it's more the follow-up care. Some women will still continue with some endocrine therapy and some medication to reduce their risk of recurrence. But at that point, they do not have any evidence of disease. I know that there are many patients, although they feel that they're happy that they completed their treatment and now they survived cancer and they're now cured. However, they enter a new world, which is they have a lot of concerns, a lot of questions. They may also experience a wide range of emotions, thoughts and concerns, anxiety and uncertainties, I would say big time, specifically fear of recurrence. I know that a lot of my patients will feel lost, will feel sometimes isolated and alone. Why is that? Because mainly during their active treatment, they see their oncologist and their oncology team, surgeons every every week, sometimes like every week, sometimes every 4 weeks, and every few months. But then after they completed their treatment, they see them every year. So most of these patients, they feel abandoned and they have now more questions and concerns. That's why I feel that we need to help patients to guide them through this phase, which is the care after cancer. When we talk about care after cancer, there are like a few different domains. The first one is surveillance and follow-up medical care, then long-term physical and psychological side effects. Then, as you know, there are some patients who will continue with adjuvant treatment for a few years, up to 10 years, lifestyle modification, and then the fear of recurrent and psychological issues. Let's start first with surveillance for breast cancer recurrence. After you complete your treatment, your physician or your oncologist or oncology team will see you almost every 12 months to ensure that you don't have any evidence of recurrence. They may ask you questions about your symptoms and signs to see if there's any evidence of recurrence. They may also perform physical exam and perform also imaging. When it comes to breast cancer survivors, the only imaging that we perform is mainly screening mammogram, and it's every year. Some women may underwent reconstruction surgeries or bilateral mastectomies. For these patients, there is no imaging required. Also, there's no other routine surveillance investigation are recommended for asymptomatic patients. I know a lot of my patients would ask me, like, how come we don't get any imaging for if there's any metastases or if there is any concerns or issues. So I will let you know that based on evidence that we don't do routine imaging for anyone who is asymptomatic. If you are not symptomatic, we don't perform any other investigations, including bone scan, whole body MRI, CT scan, MRI brains, or any tumor markers, because there's no benefits to patient survival. They would not necessarily change prognosis or outcomes. At that time, the patient is already symptomatic, and there is also the radiation risk and unnecessarily anxieties. However, if you have any symptoms, then just report back to your doctor and they will perform any of these investigations based on your symptoms. But these investigations are not done in an annual basis unless you are symptomatic. Also, symptoms that you should be aware of and report back to your doctor right away are symptoms that indicative for local or distant metastases. For example, if you have a new lump, if you have a new lump in your breast or your chest wall or axillary areas, if you have any changes in your skin, especially around the surgical scar, if there is any changes in your nipple, if there's any skin pulling, then just report back to your doctor, and your doctor may also perform more investigation, for example, mammogram or ultrasound or MRI if necessary. I would also recommend you to perform a monthly self-examination. The recommendation is to do it every month. However, we don't have a lot of evidence for that. So if you have a lot of anxiety, so it's okay. You don't need to do it every month, but it's good to just notice if you have any changes, to report it back to your doctor. Other symptoms for distant metastases, as you know, like breast cancer can metastasize to your bones, liver, brain, or chest. So if you have any symptoms, then report back to your doctor. I would say in general, anything that is persistent, like more than 2 weeks, I would say, then just let your doctor know. These symptoms could include like dry cough, shortness of breath, abdominal pain, headaches. So for these symptoms, I would recommend that you report back to your doctor, because I know that you won't be able to see your doctor every few months. You see them for the most part every year, but just book an appointment with them if you have any of these symptoms. If it's hard for you to get in touch with them, you can always book with your family doctor. All doctors are aware of investigations that should be done. So for example, if you have a new lump, then more investigation would be done. For example, if you have cough, then a CT or a chest X-ray will be done. If you have a headache, then MRI will be done. There's also an important investigation that you should also ask your doctor about, which is bone mass density. This investigation is done for women, for almost most women, because we know that postmenopausal women are on aromatase inhibitors, and these medication can reduce bone mass. So if you are postmenopausal and you are on aromatase inhibitors, just make sure that your doctor is aware of doing your bone mass density every 1 to 2 years, depending on your risk and your baseline bone mass. Also, premenopausal women, they may need to do a bone mass density. So just check with your doctor and just ask him, do you think I need a bone mass density? The other thing which is also important for during the survivorship phase, and I know a lot of your maybe doctors and your care team would not necessarily spend a lot of time talking about long-term side effects, especially during your active treatment. But we know that there are many side effects that can persist for even years after treatment. For example, fatigue, it's very, very common. Lymphedema, which is also a common side effect. Sexual health, there is, I'm gonna talk about it separately in a different seminar. Brain fog, especially for women who received chemotherapy. Menopausal symptoms, big time, hot flashes, especially with aromatase inhibitors, and also also patients who are premenopausal and who they are on, like, for example, ovarian suppression therapy. Chronic pain, some women will continue having this sharp pain, like close to the surgical scar, for many years after treatment. So just always connect with your doctor and tell them, like, oh, I do have these side effects. What should I do? If there's any medication, what are the interventions? Because these side effects can actually impact your quality of life. So these are some of the physical symptoms. We know that also there are many programs, including Wellspring. They do offer a lot of courses, a lot of programs. For example, the physical activity program. I understand that also there's the brain fog. So if you have any of these symptoms, just talk to your doctor and find support from the community, from other support groups, because you need to advocate for yourself, because not everyone is aware of these side effects. Psychological issues also very, very common. Anxiety, Like this is one of the most commonest side effects. Women will continue to have anxiety about, will the cancer be back? Like, what should I do? And now they are more anxious about every aches and pains. It's always the cancer is back. So anxiety, big time, depression sometimes too, especially if you have both physical and on top of that you have other side effects like pain that also can heighten your anxiety. Survivor guilt. I do have a lot of patients like, I didn't do anything wrong. Like, why me? Why I have cancer? Like, I've been healthy all my life. I've been like doing physical activity. Like, what did I do wrong? So it's very common to have survivor guilt. There's also a separate seminar about mental health. So again, there's many side effects, and I am happy to discuss all of these side effects maybe in the upcoming webinars. I would like to know if there's any favorite topics, so you can even put it in the chat box. So just a takeaway from assessing long-term physical and psychological side effects. If you have any symptoms, please don't feel that you're alone. These side effects are very common, and reach out for help. The third domain, which is basically adjuvant endocrine therapy. Some women will continue adjuvant therapy for a long time, sometimes 5 years, 7 years, and up sometimes up to 10 years. These medications unfortunately have many side effects. I would say almost 50% of women may experience some kind of side effects. However, these medications are very crucial, very important to reduce your risk of recurrence, but then we don't want these medications to like impact your quality of life. So if you have any side effects, report back to your doctor. Tell him like, I do have a lot of joint pain. If there's any alternative, how can I, if there's any medication, anything that I can try to reduce my pain, because it's very important to be on these medication, but on the same time we want you to have a good quality of life. So always report back to your doctor and see what kind of interventions. Some women also will continue ovarian suppression therapy, especially women who are premenopausal, and these medication can like it's gonna put you into menopause, so you will have like a lot of hot flashes, sleep issues, joint pain. So again, report to your doctor, because I know there are a few of my patients with like stop their medication because of all of these side effects. I just wanted to let you know that there are alternatives for these medications, and there's also interventions. For example, if you have hot flashes, then there is treatment. There's like a medication for hot flashes. Now, which is the final point I wanted to talk about today, because I wanted just to keep some time for Q&A, is how living a healthy lifestyle. We know that based on evidence, lifestyle modifications can improve your quality of life, can minimize treatment-related side effects, can improve outcomes in breast cancer survivors. We do have tons of evidence and robust evidence for exercise, like evidence A. The recommendation is 30 minutes of moderate intensity physical activity 3 to 4 times per week, meaning biking, swimming, cardio for 30 minutes, 3 to 4 times per week, plus resistant training twice a week. I know a lot of my patients, they told me that they cannot do that because of joint pain. They feel now very fatigued because of all like side effects. They feeling depressed. So I would say do whatever you can. Something is better than nothing. But the recommendation in terms of to reduce your risk of recurrence is at least 30 minutes, 3 to 4 times per week, moderate intensity physical activity. But if you can, that's okay. Do whatever you can. Being active, that will improve also your outcomes, mental health, physical function, body image, as well as can help you with some other side effects. I get a lot of questions about diet. Unfortunately, data for the most part is inconsistent. Like, for example, what is the best diet for breast cancer survivors? But the general recommendation is mainly to focus on fruits and vegetables and avoid processed food, red meat, and fat. Also, we need to, like, the recommendation also to limit alcohol intake. You may ask dietitians, they may know more than me, but this is kind of I'm just talking about more about scientific evidence. There's no, the recommendation is mainly to eat more fruits and vegetables and avoid processed food, red meat, and fat. Also, maintaining a healthy weight is important. We know that obesity in general is a well-established risk factor for breast cancer and breast cancer recurrence. Again, I know a lot of my patients told me, oh, okay, but after treatment of breast cancer, we gained weight, and this is an issue. And I'm telling you, yes, because of all of these medication, you may notice an increase in your weight, as well as we know, like with aromatase inhibitors, which lowering your like estrogen, this can also delay your metabolism. So try your best, because we know that maintaining a healthy weight can improve your quality of life, and obesity can actually increase your risk of the cancer coming back. The other important thing is limiting alcohol intake. Now we have more and more data. The recommendation is to limit your alcohol intake to less than two glasses, like 2 drinks per week, not more than 2 drinks per week. But for sure, like, just to have fun, and like, you can take alcohol, like drink alcohol like occasionally, but not on a regular basis, not more than two per week. Another important thing is maintaining a healthy bone health. So I would recommend most of my patients to take vitamin D 1000 to 2000 international unit, as well as make sure that they take calcium. And the recommendation is mainly from diet. You can also check Osteoporosis Canada to get more information about calcium rich food. Another important thing is also stopping. If you are an active smoker, we know that there is an association between active smoking as well as breast cancer recurrence. So seek help if you need some support to stop smoking. Emotional well-being is a big thing. As I said, like fear of recurrence as well as anxieties. So just know that you are not alone. Breast cancer diagnosis will bring about many emotions, and at different times throughout your treatment or recovery. So there's no rule, like you can spend, there's no limit for recovery. I know a lot of my patients felt really happy during active, not happy, but well supported during their active treatment, but then they had they've been having a lot of anxiety symptoms, even more now during their survivorship phase. So it's okay, it's natural to have good and bad emotions through this experience. And I just wanted to remind you that it's okay not to feel positive and strong all the time. There will be just a specific webinar about mental health within the coming few weeks. This is kind of the most important things that I wanted to include for today's talk. I wanted to welcome you to join our upcoming sessions within the coming few weeks as well. And if you need more information, I will provide everyone with a handout just to give you more guidance for today's session. Also, a list of community as well as support group resources and website just to refer to if you want more information. And I do have my contact info there if you wanted, if you have any general question, I'm happy to answer you. I also have a website as well. And yeah, if you have anything, you can always contact me directly. Now I would like to hand it over to Jennifer just to talk more about her experience during survivorship phase and some of the challenges that she wanted to share with us today. And yeah, Jennifer, just let us know and if you want to share your experience.
Thanks, Muna. Okay, thanks, Muna. My experience is a lot of what you had mentioned. I've completed treatment and surgeries and all that in September of 2016. I did it backwards. I did chemo, then radiation, then mastectomy, and then an axial node dissection 6 weeks behind that. So from start to finish, that was about 9.5 months solid of treatments and surgeries. And the first word that comes to mind was, the first word that does come to mind is I was lost, just completely lost. I couldn't concentrate, right? I had chemo brain. I couldn't read a book. It took me 2 years to start being able to read again. I was exhausted emotionally and mentally. There isn't much support out there. You know, there's all this support while you're in treatment, but once you're done, you're kind of like left to your own devices. And mentally, that is not a very, very good place to be. I do believe we all have a form of PTSD. I did. And of course, then you have all your anxiety around all your scans. Every time a scan comes up, every pain, Muna, no matter how many times you tell patients this, it doesn't matter. Every new pain makes me afraid. And my oncologist just retired and I've been released, and I don't trust my family doctor enough to be vigilant. And I'm used to being scanned every 6 months. I'm used to being in the chemo ward to get, you know, a treatment every 6 months to try to slow down my bone density loss. And now I'm not. And so after almost 8 years of continual, almost 8 years of continual care, I'm alone. I'm afraid. I'm not alone because I have a lot of friends who are survivors and I'm involved with after breast cancer, but you are alone. You know, even being asymptomatic doesn't mean I don't have my fears. And it took a while to get my concentration back. It took a while for my fatigue it took 2 years for the fatigue to go away. I still have cording, but I have use of my arms. I lost use of my arms and had to do I had to do physiotherapy twice to try to pop the cords. No one had warned me about cording. I had only been told about lymphedema. So that was another thing. 3 months after my last surgery, I couldn't lift my arm over my head and had no idea what was going on. And at least then I was seeing my oncologist every month because I needed my Zoladex shots. I had my ovaries removed because I was not going to have another child. But at least I saw my oncologist monthly that I could say, wait, what about this? But when that's gone, I guess I kind of feel lost still. I really do. I don't dwell on having had breast cancer, but I live it every day. Right? I see it in the mirror when I look in after the shower. I've had a mastectomy. And that right now is my biggest challenge in survivorship. Someone asked me a couple weeks ago if I was more uncomfortable having a breast than not having a breast. And that to me is an extremely powerful question that no one has ever asked me and I hadn't asked myself. And I think at the moment I'm more uncomfortable having one than not having the other. But it's not the scar from the surgery, it's the scar of I was 20 pounds lighter and I had 2 breasts when this started. I don't feel like me. I look like me, except heavier. I can wear my clothing again. But I'd say for me, most of my struggles are my body imagery and my body image. We'll get to sex in a few weeks. The lack of sex drive, the lack of desire for intimacy makes you even lonelier. So all of these things, all our little talks, Muna, come together. I have been taking off, I've done exemestane, I've done Zoladex, I've done tamoxifen, I've done letrozole. I'm missing 1 or 2. I can't stomach them. And my oncologist knew that, okay, let's try another one because I won't take any of them. And when my last chemo was my first Zoladex shot, and I was started on exemestane. And 3 weeks later, I have to tell you that I was the biggest raging monster. I'll use the word monster, between the hot flashes and the emotions, and I'm starting radiation at the same time. So I'm having hot flashes and radiation. And finally, after 7 years, my oncologist said, you know what, no more of the pills. I knew I was going to say 10 years, but you're not going to take them because they destroy your stomach. So at least the hot flashes have abated a bit. There's a perk. But, no one warns you of these things. Just like no one warned you when your hair started growing back that you go back into puberty. No one warns you about how lonely at times you'll feel. And how, it doesn't matter to me what people say, oh, you look great. Thank you. But that's not how I feel because I'm a different person, physically and mentally, after breast cancer. So that's the short haul of a long story. And I apologize because that was a long haul of a short story.
Thank you so much, Jennifer, for sharing this. This is really very powerful to share your experience in front of everyone. And I know that a lot of my patients have their own unique story, but Jennifer, she just mentioned like almost the whole list of all side effects that no one like counseled you about before. So that's why we're gathering today to talk about all of these issues and challenges that breast cancer survivors may experience. So thanks once again, Jennifer, for sharing.
Well, so much of it is, once you're first diagnosed, everything is moving to treatment or surgery, right? There's no time to tell you about these things. The goal is to get you cancer free, right? And have no visible sign of disease. But towards the end, my oncologist was very good. She did talk to me about quite a few things, and she had I had an appointment with the oncology psychiatrist, and he had recommended mindfulness for me, which didn't work for me. It's not me. And I was sitting in a mindful group therapy, but everybody in that group therapy had mental health challenges.
Right.
Like anxiety, depression, inpatient in hospital. At that point, my cording was so bad, I couldn't sit. They wanted us to sit with our arms out, kind of meditating. I couldn't even do that. So how could I concentrate on being mindful? But it didn't, that wasn't for me. Now, I know a couple people after breast cancer, mindfulness works great for them.
Exactly. Everyone is
right?
different.
I could color. That's how I started getting my concentration back, was I was coloring. It's so hard because we're all unique and we all have different things that work for us.
Yeah, and that's great. I think that's actually the most important takeaway, that everyone is different and everyone has his own like way to recover. So just to be mindful for the time, I would like to open the floor. I know that there's a few questions, and I'm happy to maybe to me or to Jennifer, like to talk to address these questions.
Okay, well, perfect. Thank you so much. I just wanted to say a quick thank you, Dr. Muna and Jennifer, for sharing your story and for sharing the wealth of knowledge and experience that both of you join us with. So